course, when we have to deal with a patient and with a patient diagnosis, it's better to have the initial diagnosis, which is already approved by the consultant or orthopedic traumatologist in their country, because for us it's much easier to plan the operation, because we are dealing not only with the bones, but also we have to deal with the ligaments. And when we have initial diagnosis before the procedure, it's better to plan for the surgery. X-ray, it's not a huge issue before the procedure. Of course, when we have to plan the procedure and if we want to order implants before the procedure, so we have to have X-rays before the procedure, but it's not a big problem because we have a huge radiological department in our clinic, and we can perform the X-rays before the procedure one day or elective surgery day. First direct consultation will be before the procedure, so it means in operative day. Some of the patients which comes earlier, they can have initial direct consultation before the procedure one day before the surgery. All the time when the patient have questions, and do not hesitate to contact us, and we can organize online consultation before the procedure. Yes, personally I perform partial knee replacements.
After the surgeon agrees that you are a suitable candidate for the operation, we then schedule a date according to your liking. We look for the flights and suitable hotels for your stay. And by us, I mean patient happiness manager, me, Tomas, or Carlos, my colleague.
In order to make the procedure safe for the patient and also for us, as surgeons and team, all the time we asking the patients to fulfill the anesthesia form before the procedure. Why it's important? Because if a patient have huge comorbidities, we have to evaluate all these comorbidities before the procedure. Especially it takes a huge time for anesthesiologist to evaluate for the patient and to manage safe procedure. So sometimes the anesthesiologist and the surgeon ask to perform the general blood test or ECG for the patient if they have cardiac problems, and especially when we are talking and when we have to deal with the post-traumatic cases, so we all the time asking to provide us initial preoperative X-ray before the procedure.
Upon your arrival, you will be met by your patient happiness manager at the airport. He will have a sign saying "Wellness Travels, welcome," and you will meet them by that. Upon our first email, you already receive a quote which is without any hidden fees. The flights, accommodation, surgery, implant, medical tests, and intensive physio, you may save up to 50% of the cost you would spend back in your home. We provide the exact quote by email, and there is no hidden fees.
It's an interesting question. No, the answer is strict, and it's no. We are using very modern knee implants. They are manufactured in Europe, and also mainly of them are manufactured in America. And we are using these implants, which shows the best long-term survival results. From the surgery perspectives, it's safe to travel back at home in early postoperative period, because pain management will be ensured by the painkillers, which will be prescribed in our clinic and during your trip back at home. Deep vein thrombosis prevention will be ensured by the compression stockings and also oral anticoagulants. They will be prescribed also when you will leave our clinic and our rehabilitation center. Time period after the procedure is safe according to all the evidence-based literature which is provided in medical science papers.
No, all the staff speaks fluent English and you will have no problem communicating with any of the staff members. You do not necessarily need someone accompanying you during your stay in Lithuania, because all the nurses will be looking after you and making sure that you recover and have a good time here. Considering that rehabilitation is done under one roof where you had your operation, you don't need to travel anywhere else and will be staying entirely at our clinic.
After the knee replacement, patients are allowed to walk with a full weight bearing without any restrictions, mainly patient using just one ulnar crutch to walk, so it's not a huge problem to travel even alone. When we are speaking about the patient comorbidities, we all the time want to know before the procedure what kind of comorbidities patients has and what kind of a disease we have to deal in early postoperative period. So it's all the time we are asking patients to provide all the medical records that we have in their countries. In our clinic, we'll provide all the necessary equipment for the patient after the surgery. So the patient will got the crutches and also the compression stockings, and they will use these devices during their flight back at home.
On the day of the surgery, usually in the morning, we will meet you at your hotel and take you to the clinic for x-rays, blood tests and ECG. After those are done, we will guide you to your room where you will be having a consultation with your surgeon, anesthetist, and we'll be waiting for the surgery.
After the Thomas, when the patient are already in the ward, surgeons, we are coming into the ward and we have the preoperative consultation. Before the procedure, we try to explain and to show the patient all the preoperative findings in the x-rays that is already done in our clinic, and we are providing all the necessary information for the patient about the surgery, about type of implant that will be used during the procedure, explaining about the anesthesia. Mainly all the knee replacements are done under spinal anesthesia. Also patients get the intravenous drugs that they can comfortably sleep during the procedure and won't hear any unnecessary voices during the procedure. Operation takes around 2 hours and then the patient comes back into the ward. The main goal after the knee replacement is to fulfill all the steps that is necessary that the patient as soon as possible comes back into a normal daily life. So that's why after the procedure, first 2 postoperative days were very intensive, and during the first postoperative day the physiotherapist will come and the patient will have exercises with the physiotherapist, also the dressings, general blood testings to evaluate the postoperative anemia will be performed during this time period.
And after you are moved to the rehabilitation facility, which is, like I said, in the same building, you will start having a proper physio sessions, which consist of lymphatic massage, manual hand massage, 2 physio sessions and kinesiotherapy. Yes, you will have no problem paying by card. Also, just make sure before making the transaction to increase your limits, as most banks have limitations to one-time transaction. You will be given a meal plan, which you will set for the next week or so, depending how long you are staying at our rehabilitation facility. But be aware that you can also adjust it as the days goes on if you want to alter some meals.
All the sutures after the knee replacement are dissolvable, and it's not necessary to remove stitches in their countries.
You should travel lightly, as after the operation you will have one crutch in your one hand and the luggage in the other, so it may be difficult to maneuver around the airport.